My name is Jeannie Shapiro, and I'm the Executive Director of the Clearwater Free Clinic. I've been here 13 years, and I consider this a dream job. It's a labor of love. I go home every night, and I feel fantastic about the things we've been able to accomplish. What makes the clinic really special is that it's volunteer-driven. With the exception of 6 paid staff, we're able to treat over 14,000 people a year and provide 33,000 courses of medication to our patients and provide $3.3 million worth of services. That's pretty remarkable when you think that you only have 6 staff, and so the volunteers make up the heart of the clinic.
My name is Paul Steele. I work at Largo Medical Center Emergency Room. I'm the Associate Medical Director there. Been there for 20 years, and I volunteer here at the Clearwater Free Clinic as the Medical Director.
We have specialists, we have cardiologists, we have a pulmonologist that comes in, we have gynecologist that comes here, orthopedic doctor, a neurologist, actually 2, one here and one that we have access to in the community. We have an endocrinologist in the community that we can call and he'll see the patients. We have an oncologist that comes here, and we have an oncologist in the community. That's been a wonderful pathway for a lot of our patients to get needed care for that type of illness.
Back here, we're going to go to the last room there on the left.
I was without anywhere to go. You know, I found, somebody told me about the Clearwater Free Clinic here in Clearwater. I came down here, and more important than what was wrong with me, and there was a slew of things wrong with me after they finally got done doing tests on me, from cancer, high blood pressure, COPD. These people are helping me cure all of it and helping me sustain life through all of this. It's how they do it is most important. They are the most wonderful, the kindest, most caring people that do all of this for absolutely nothing.
It seems to me that people are coming to us are sicker. They've waited too long. There are people who have opted not to take health care insurance, possibly when they could afford it. They made choices, and their health care suffered for it.
When you have a patient come in and say, you know, I make X amount of dollars, yet they're expecting me to pay $500 a month for my health insurance. Well, if I pay that, I can't pay my mortgage and buy groceries. I can't pay my rent and buy groceries. You know, it's 2/3 of my income is what, you know, 1/2 to 2/3 of my income I'd be paying to have my health insurance. I gotta eat. I gotta have a roof over my head. So, you know, they really do have to prioritize, and sometimes the health insurance just doesn't fit into the picture.
I don't think that I would be here today, or I would be able to do anything today and get up and walk. I can still ride a bicycle around with COPD. Every month they give me breathing medications. I can still work. I don't have to depend on the government or the state for disability. I still have an active life at 59 years old, which I should, I feel, but it's all because of that. And I thank God for him every day.
Because of chronic disease in our society, diabetes, hypertension, heart disease, chronic obstructive lung disease, these diseases you just don't treat in one visit. And if you care for them over the long term with a good plan of maintenance, these people stay out of the emergency room, they stay healthy and work. So it's kind of evolved into, yes, a chronic disease management situation here. And we do have track records of patients being here many, many years because they're still in that socioeconomic situation where they may be working and they're, you know, trying to make ends meet, but they still have no access to health care.
I truly believe that a lot of our patients, just a couple circumstances, you put them where they are. We could have a back injury, we could have a catastrophic incident in our family life that could cause a mental break. I mean, there's a lot of things that can happen to a person, and one day you could be sitting fine, have a great job, have a wonderful home and family, and then the next day something horrible could happen. And I think it could happen to any of us, and that's why I enjoy giving back, because I hope it never happens, but it could be me someday that needs some help.
We have a gentleman right now going through chemo for colon cancer who still works full time. And he falls through the cracks, or would fall through the cracks, because he doesn't qualify for any other programs because of what his income status is, but yet he can't get other programs because he can't afford them or have access to them, doesn't have a resource for insurance.
No, I do not have health insurance. And I do have health problems. When my husband was working, we did have it. And we kept it for a while, but it was so expensive, we couldn't afford it.
Okay.
And I've been coming down here to the clinic for many years, and they have been my life support.
We know that the more underinsured, self-pay patients that end up in a hospital, that cost is ultimately passed on to the people with insurance. And so if you can keep patients out of the hospital, out of the emergency room, taken care of by a free clinic, ultimately everybody wins, because your insurance payments should not rise as high as they will ordinarily. The message to the people who would like to donate is there's no waste here. Your donation goes to a great cause.
We're very good stewards of the donations at the Clearwater Free Clinic. And we're very proud to say that for every dollar donated, we provide $5 worth of services to the community. I can't imagine what these people, our patients, would do without the support of the volunteers in the community if this clinic weren't here.
Basically, it's very gratifying to take care of patients who thank you, who know that you're doing it because you care. And this is the way I think the whole staff approaches this, from the pharmacists to the nurses to the clerical staff. You know, we're here for them.
You come to work here, you buy into it. I mean, you're here for a purpose, you're here for a reason, and it's what keeps us coming back, even on those days that we're here for a long day and you're real tired, but you love what you do and you see the results of what you do. I can go to sleep at night knowing that we've helped some people.